Welcome to Pregnant in the Netherlands, your guide to pregnancy, birth, and beyond. I'm Juliana, a birth doula and a childbirth educator.
And I'm Anna, a doula, childbirth educator, and lactation counselor. We're here to support you with evidence-based information and honest conversations that help you feel confident, informed, and empowered throughout your pregnancy, birth, and postpartum journey in the Netherlands.
Good morning.
Good morning. How are you doing?
Pretty good for a Monday morning.
Yeah.
And you?
Yeah, me too. I actually had kind of a interesting thing happen. I got a WhatsApp message the other day. It was from somebody that I didn't know, and they were saying, "Do you remember having a pen pal?" I was like, "Yeah, but the names didn't match up." Turns out this person that messaged me was my pen pal from 7th grade when I was like 11, 12 years old in China. My 7th grade teacher taught in China for some time and then came back to the US, and we exchanged letters with some of her former students. And this girl and I continued writing to each other, I think for like a year. And she moved to the US from China a long time ago, and almost 20 years ago. And she said that she tried to look me up and just never connected. And then decided to try to look me up again. And yeah, we last night sent like a flurry of messages to each other, and I actually dug through some of my like keepsake box and found her old letters and everything.
Oh, that's so cool that you still had those letters.
Yeah. I couldn't believe that I had kept them with me. After moving around.
Moving so many times, yeah.
So, yeah. So that's just my
Oh, that meant to be. Nice.
kind of cool news.
And she still lives in the US.
Yeah. She got married recently, and I'm so curious to like continue to find out about her and her life and everything. We mainly would write to each other about like, I'm doing homework, maybe some extracurricular activities, and then we would tell each other about our festivals and stuff. So learned a lot about the Mid-Autumn Festival and then the Spring Festival or the Lunar New Year festival, things like that.
Oh, this is so cool.
Yeah, it was really neat. I just like mind blown that this person from across the world, I'm reconnecting with them like almost 30 years later.
Nice. Also, like with social media nowadays, the world is just getting smaller.
It's true.
You can reach out to people who you haven't met for ages, for 30
Yeah.
years. Our topic for today, who is who in your Dutch theme, in your birth theme in the Netherlands?
Yeah. And I think we kind of touched on the different midwives in one of our first episodes, but I think that it'll still be good to touch on it again.
Yeah.
And expand.
And I had the idea to make 3 categories or like phases during labor, birth, pregnancy and birth, and then right after birth, and then longer period after birth.
Nice.
Yeah. So, yeah, because you meet a lot of, or you get to know a lot of people, or at least their names, like midwife, as you said, Verloskundige, or vroedvrouw. Some midwives like to use that expression instead of Verloskundige.
Yeah.
And then you hear kraamverzorgster, which is the maternity nurse, and all other people who can help you and who will help you and support you.
Yeah.
So let's start with the midwife.
Yes. So we have different types of midwives, right?
Yeah.
There's the local midwife. How would you?
Yes, the midwife, I think.
Yeah. Yeah.
Yeah. Officially, they are called first line.
First line. There you
Yeah.
go. Your first line midwife that you go and make an appointment with once you have your positive pregnancy test. And she's going to be the one, or that practice is going to be the one that follows you throughout your pregnancy as long as you remain low risk.
Yes. And she's going to be there with you if you give birth at home or in the birth center or in the hospital without medical indication.
Hmm. And that
And
first line midwife, that practice could be 6 different midwives, or it could be a really small practice, like two midwives, right?
yeah, yeah. So you can look at your midwife as your project manager around pregnancy and birth. And then we have the clinical midwife, the second line midwife, who works in the hospital, and she supports you when once you have a medical indication or reason to be in the hospital. And they often work together with the gynecologist, but it's the best if you don't see the gynecologist. I always say, like, no offense,
Yeah.
but that means that there's nothing, that there are no serious complications or the decisions that needs to be made by the gynecologist. So the clinical midwife is there for you in case you ask for medical pain relief or if there are any medical issues, and you're often transferred from your own midwife to the clinical midwife, your case.
Hmm.
So your own midwife is going to come with you to the hospital, but then she would leave and the clinical midwife takes over your case.
Yeah. Yeah. Unless you've been given some kind of medical indication earlier on in pregnancy and your care has already been transferred to the hospital. For
Yeah.
example, like gestational diabetes
Yeah, that's true.
or even maybe hypertension or
Yeah.
signs of preeclampsia.
And we have the gynecologist.
Hmm.
And I think in a lot of countries you only meet the gynecologist, so it's a bit confusing. Different kind of midwives and the gynecologist you don't actually want to meet.
Yeah.
So when there are complications, then the gynecologist comes also to your room and explains the scenarios, and they make the medical decisions. They are in charge for interventions, surgery, also.
And these are so kind of talking about the different trainings. Midwives have a different type of training than gynecologists do. Gynecologists are medical doctors, and so they go to
Yeah.
medical school, and their training around birth tends to be within the context of like pathology or when things go wrong.
Hmm. And I think you also had obstetrician on the list,
Hmm.
but we don't really have that in the Netherlands.
I think that that's the surgeon um, when it needs to when a cesarean is needed, then it's somebody who is a trained surgeon. Um,
But
in
it's
the
still the gynecologist.
That's still the gynecologist. Okay. In the US, we call them OBGYNs.
Yeah.
So they're gynecologists, trained as gynecologists and obstetricians. So they can do both, support a high risk birth or a medicalized birth, as well as perform the surgery of a cesarean if needed,
Hmm.
or other gynecological surgeries. So then here in the Netherlands, gynecologists are trained as surgeons as well. Is that correct?
Yes.
Okay. So then,
Yeah.
yeah, very similar.
Yeah. It's just a side note that they have like also different scope of like research topics. Like they always do, part of their job is doing research in
Hmm.
certain topics. They have their own field. So
Mm.
one is going to go deeper into induction.
Hmm.
The other one is going to go deeper in what happens if you pass week 41, 42 statistics and stuff like that.
Hmm.
And then also translating that to the for the hospital's protocols.
Yeah. So they all kind of have their specialties.
Yeah, their own expertise.
Yeah.
And once or when we are talking about birth, pregnancy and birth, then we really must mention birth doulas, right?
Yeah. A birth doula is really there, hired by the birthing person, the birthing family, to be physical support, emotional support, informational support, but it's non-medical.
Yes. And the birth doula is someone who you meet during your pregnancy already. Most of the doulas do like private childbirth preparation course. You meet like 3, 4 times with your
Mhm.
clients, and then you are also continuously present during labor. I just said that the midwife was the project manager. Then I would say that the birth doula is the support specialist.
Nice. Nice. And then the other person that you might meet, if you have a hospital birth, is a hospital nurse. And that's a registered nurse who will be there to perform medical support. So she or he assists the clinical midwife or gynecologist with things like blood pressure and setting up the IV.
If you push the red button in your room because you need
Yeah.
someone, then she's going to come in and ask you what you need and will give you the pillow or measure your temperature.
Uh-huh.
Yeah.
Or help set up a shower or yeah, things like that. And then if you have a home birth, you won't have a nurse. Well, you won't have a hospital nurse with you, but you'll have the maternity nurse,
Yes.
and that's the kraamverzorgster.
Yes. Which people usually refer to as kraamzorg, which we
Uh-huh.
learned that it's not correct.
Yeah.
So the person comes to your home for 8 days in the best case scenario, and then helps with the baby care, feeding, and also supporting your recovery. And they also do light household stuff like vacuum cleaning, doing the laundry, preparing breakfast for you,
Yeah.
supporting you in those days.
But they're also there during the birth assisting the midwife, right?
Yes. It's also depending on the midwife. I see that sometimes when they are, especially if it's a really experienced midwife and they are like, oh, we already have a doula, I'm okay. If the maternity nurse comes later.
Mm.
Sometimes I see that they really need assistance and they really want to call someone on time, and then we are all there. but
Mhm.
that's okay. It's like, yeah, we can still work really nicely together. And I think it's also nice for the maternity nurse if she's there before the baby is born, because then she can prepare the clothes and warm up the bottle and arrange things. So then afterwards, it's easier to actually start life with the baby.
Yeah. Yeah. Nice. So yeah, that kind of transitions us into the immediate postpartum time
Yes.
category. Within that first week or two after giving birth, you'll be visited by the maternity nurse and your midwife.
Yes.
The midwife is checking on you as well as your baby.
And if
Mm.
you need extra support with breastfeeding, if the breastfeeding is challenging, you can discuss that also with your maternity nurse, with your midwife, and they will tell you to turn to the lactation consultant. So lactation consultants are not always needed, but if they are needed, then they are really needed. So,
Yeah. Yeah.
and it's amazing that they are there for you to help.
Yeah. Having some kind of lactation support, whether it's from a family member or through your midwife or your maternity nurse, is really needed. I think that we need to normalize that a bit more. That breastfeeding isn't just this thing that's going to magically happen. It takes work to do on
Yes.
your part and your baby's part. Yeah, there's a learning curve there, and having support makes it go a lot smoother.
Can you also briefly explain the difference between lactation consultant and lactation counselor?
Yeah. So, a lactation counselor, which is what I am, is someone who has a lot of education, about the same education as a lactation consultant. In my case, I took 95 hours of breastfeeding specific education. The difference is a lactation consultant also has a certain number of hours that they have spent doing breastfeeding support. And then they take a board test exam. And once they pass that exam, then they are called internationally board certified lactation consultants, or IBCLCs. So they have a lot more experience under their belt than a lactation counselor initially. And then also they've passed an exam, a pretty rigorous exam.
Okay.
Within the first week, you'll also be visited by the consultatiebureau, or the GGD,
Yes.
and they will check on baby and do a heel prick to test for a number of metabolic diseases.
Mm-hmm.
They'll also do a hearing test for the baby.
Yes. It's like between day 4 to 7 when the baby is 4 days old, 4 or 5 days old. And that's usually arranged by the maternity nurse, and they indeed take a few drops of blood from the baby's heel.
And then after that first week, you'll be invited to go to the consultatiebureau a few weeks later for your baby's first vaccinations.
If you decide to
Vaccinate.
give the
Yeah.
vaccinate your baby. Yeah.
Yeah.
And they are also checking the development of your baby. They are also helping you with what should my baby be able to
Mhm.
do. And if you have any concerns, you can always check it with them. So we are
Mhm.
talking about a healthy baby. And in case your baby is sick, your baby has a high fever, then you would go to the GP, family doctor.
Yeah, so the consultatiebureau kind of does routine checkups to check development, and then anything out of the ordinary, you would go to your GP, to your family GP.
Is there a word for consultatiebureau in English? I was really trying to find one, like advising office.
Here, it's a very different system than anywhere else that I've
Yeah.
lived. In the US and also in Vietnam, baby has a pediatrician. So it's a
Mm.
special doctor that specializes in kids and babies. And yeah, they see their pediatrician routinely for the routine visits, and then as well as like sick visits. If you have concerns about your baby's health, then you would talk to the pediatrician rather than
Mhm.
a GP. So yeah, I don't know that there's an English equivalent, like an English word to really describe the consultatiebureau.
Consultatiebureau.
Yeah, yeah,
But I think after a while, you just learn it and you just use that word.
yeah, hmm yeah, exactly. Yeah, yeah, and I've heard it as the consultatiebureau, or the GGD, or the GGD.
Gemeentelijke gezondheidsdienst.
There you go.
And the postpartum doula.
Yeah. So you might decide that you need some extra support for when the maternity nurse's time with you ends. And having a postpartum doula is a lovely extension of that help, but it's not necessarily medical help. So, just like the birth doula, the postpartum doula is there to support you in your recovery, but she doesn't perform any kind of medical tasks. So, she won't be checking your incision, she won't be checking your blood pressure, anything like that. But she will be there to prepare food for you, to help you with household tasks, to help you with breastfeeding support, and kind of guidance on what to expect from yourself in your recovery process, and then also from your baby in their developmental process in the first few weeks after birth.
Yeah. And it's ideally, as you said, it's like we have a client now. I'm her birth doula. And in the first week, she will have the maternity nurse who is supporting her. And then when the maternity nurse will leave, then you
Hmm.
come in the
Yeah.
picture and then you will continue supporting her. And
Yeah.
that's really the ideal world to have this amount of support, be able to just concentrate on your family.
Yeah,
and
exactly.
Transition to becoming parents.
Yeah. Yeah. And it's, I think, especially for expat families who don't have parents or aunts or sisters or other family members close by, having a postpartum doula there to be the extra set of hands is really helpful.
Her sister is also coming, but they were really questioning when should she come? Like you
Mhm.
cannot plan from now on up until 5 weeks. The
Mhm.
baby can just come anytime. And then how
Yeah.
are you going to book the ticket?
Yeah.
Yeah. I think we are done, right? With the,
Yeah.
the
Yeah.
theme.
I think we covered from early pregnancy to well into the postpartum period.
Yes. I hope this give a good picture and explanation of who are you going to meet when you're pregnant, and you will know what those people do
Yeah.
and
Yeah.
how they help you and support you. Because of course, that always helps to just be in charge. If you know exactly what to expect from which person and you don't have uncertainties, what is she going to do?
Yeah. And if you have any questions, feel free to leave a comment or reach out. We're happy to answer them.
Now, see you in the next episode.
Until next time.
Bye.
Bye.